My next question is for Director Wade. Director Wade, what are your thoughts on the recommendation for a new social insurance program? And what are the next steps for the state master plan on aging?
That's exactly right. This is exactly the time that the master plan on aging is taking a hard look at this issue. So just to remind everybody, I mentioned we started last June 2019. The governor will be releasing the master plan for aging. The plan is this December. So about 2.5 months from now, we will have the master plan. We just received from the stakeholders 743 recommendations. And as you've heard from Christina and Fernando, this is one of the top ones. So, and we just received from the Dr. Penn and DHCS's work, the actuarial study on this. So right now, the cabinet work group is beginning to meet and to consider all of those recommendations, all of that input. And to be clear, the administration has not taken a position on this yet, and it is under review. But some of the questions that we are asking are exactly as Dr. Pan so ably and wisely teed up. And they're really about looking at there's conversations happening in a couple areas. So one is this question about between settings, where are we living and where are we spending our healthcare dollar? Nursing home or assisted living or home and community-based services. How could this help maybe reduce costs on one side and quality of life and independence and choice and create on others? So it's very well said by Dr. Pan, looking at across settings. We're also looking across states, right? What's the Washington experience? What's the California experience? What can we learn? What's similar? What's different? We're also looking to the federal government, as Professor Torres Gill lifted up. The role of Medicare is inescapable in all of this, thinking about how a state fund and a Medicare fit together is critical. And so I would urge everyone to be looking at candidates for federal office, whether Senate, House, or President, their positions on Medicare and how they tend to tackle this issue. And then lastly, I would also just say there have been some discussions about private solutions, private sector solutions. The governor's Alzheimer's task force, chaired by Maria Shriver, looked at some of those as well. And again, the trade-off with a universal, more comprehensive approach. So all of those questions, looking at different types of current spending, as Dr. Pan said, looking at federal options, looking at other state options, and looking at private solutions to try to get to where the right place to be. And then the last thing I'll just say is, listen, we all know it's tough financial times, which cuts a lot of ways, right? We both have imperative to do things, and we have to think harder and more creatively about how to find the money. But this is a 10-year plan, so we will absolutely, our desire is to set these big, bold goals. You saw it with our governor yesterday on climate change and zero-emission cars, but then also take concrete steps right now to start moving towards the future we all need to be in.
Thank you, Director McCoy Wade. Thank you so much.